A production fee for your Hometown Health Connection was made by Buffalo Healthy Living Magazine and its sponsors. What is Medicare? The U.S. government website states Medicare is a federal health insurance program for people aged 65 or older. People younger than age 65 with certain disabilities, permanent kidney failure, or other serious conditions may also be eligible for Medicare. The program helps with the cost of health care, but it doesn't cover all medical expenses or the cost of most of the long-term care you may need. You have choices for how you get Medicare coverage. Original Medicare, Part A, Part B, there's other parts. Coverage doesn't cover everything, such as prescriptions, co-payments, co-insurance, and deductibles. And you can buy Medicare supplement insurance, Medigap, a policy from a private insurance company to cover some of these costs. However, you'll also need to purchase Part D, prescription drug plan, in addition to Medicare supplement. Now, if you choose Medicare Advantage, you can buy a Medicare-approved plan from a private company that bundles your Part A, Part B, and usually Part D into one plan. Medicare Advantage plans cover all services covered by original Medicare Parts A, B, and often D. Prescription drug coverage and additional benefits like vision, hearing, and dental care as well, and even a fitness program. Now, if all of this sounds complicated, and it does to me, and probably many of you, we're going to meet a guest on this edition of your Hometown Health Connection who's going to sort it all out as we go through the Medicare Maze on this edition of your Hometown Health Connection. I'm John DeSciullo. Welcome to the program. Ken Sciarrino is with us, Regional Vice President of Essential Solutions, the Northeast region, and we welcome you to the program, Ken. We have a lot to cover. Absolutely. And I'm going to put my glasses on and read my notes because I don't want to miss anything. Because if someone's facing the age of 65, like yours truly, I'm 63, so I'm soon going to be there, and you need to transition to Medicare, or maybe you're already receiving Medicare, why should somebody need to consult with you to sort it all out?
Well, Medicare is complicated. We really take the complicated out of it. We make it easy for our clients to understand what they're getting into, right? All the different parts of Medicare, what the solutions will be, whether it be Medicare Advantage, Medicare Supplement, etc.
What is original Medicare? What does that mean?
So original Medicare it comes in two parts, Part A and B. So A is hospital coverage. That's really what everyone is paid into throughout their lifetime. So there's hospital. Part B is medical coverage. That's outpatient medical. That's where some cost comes in. That's where folks kind of get blindsided a little bit once they turn 65 and realize that when they have Medicare, full original Medicare Parts A and B, that they may have some out-of-pocket cost.
There's a lot to cover, and if you're watching, we want you to stay with us for this half hour because we're going to have information on where you can connect with Ken as well. But a question that I had, and Annette Pinder and I talked about it from Buffalo Healthy Living Magazine, the difference between Medicare and Medicaid.
Oh yeah.
I hear that a lot.
We get that often.
I'm concerned about
absolutely.
What that is.
So Medicare, think of it in terms of federal and state. Medicare is a federal program, right? Usually for those over the age of 65, or if someone's on Social Security disability for 24 months, those individuals also can have Medicare. But Medicaid is income-based. So Medicaid in New York State, it's called Medicaid. It is an income-based health care. And folks can have both. Those individuals are called dual eligible. They can have Medicare and Medicaid, or Medicare and Medicaid separately.
So it's not something where it's one or the other. You might be able to have both.
You might be able to have both.
Considering your financial situation.
Exactly.
And of course, living in New York State.
Yes.
Yeah, okay. All right, so now we're going to get into the weeds here a little bit, Ken. So what can you do to cover, what does Medicare cover, basically? And what kind of additional coverage might be necessary or recommended?
Yeah. So original Medicare A and B, as I mentioned, is hospital and medical coverage. There's no cap on that coverage, right? So there's no maximum out of pocket. There's really a deductible and then co-insurance. And there's no telling exactly what your out of pocket costs are going to look like, right? Someone on original Medicare should consider a Medicare Advantage or Medicare Supplement coverage. Medicare Advantage becomes a primary coverage, and it offers all of what original Medicare covers, but then you can actually safely know what your copay or coinsurance amount is going to be for every health service. You have a built-in maximum out-of-pocket dollar amount. You have built-in prescription drug coverage, and even ancillary benefits like dental, vision, hearing, fitness benefits, over-the-counter items.
And that's Medicare Advantage.
That's Medicare Advantage.
So let's continue on that track then. So with Medicare Advantage, I hear sometimes of $0.
Zero premium.
What does that mean?
So zero premium meaning there is no extra cost for adding this coverage on, right? So an individual with Medicare A and B could qualify and have a $0 premium Medicare Advantage plan. It could come with regular standard co-payments. There are plans that have premium that could have slightly lower co-payments, and there's different types of Medicare Advantage plans as well.
So this is why a visit to you, Ken, is important to sort this
Absolutely.
out. And I would think that the individual's medical situation would come into play when you consult with them. You know, thank God, I'm in pretty good shape. I'm in pretty good health. But if somebody is diabetic or somebody has an issue with another, maybe even catastrophic situation,
Yes.
or they're prone to some condition, how do you consult with them based on those medical needs, and does that impact the cap that we just talked about?
So every conversation goes through this naturally, right? It's a natural progression of let's talk about your doctors, let's talk about your medications, let's talk about your healthcare needs, right? If we want to get that individual comfortable with us, to really build a relationship where they are comfortable enough with us to share this, so we can accurately project what situations they're going to be in through that year. What out-of-pocket healthcare costs are they going to have? Well, if it's determined that they could potentially, based on healthcare need, meet a maximum out-of-pocket on a Medicare Advantage plan, we may want to have a completely different conversation, something around the lines of Medicare supplement and a separate drug plan. That's where someone is paying a little bit higher, quite a bit higher on a Medicare supplement premium, but then they may have lower out-of-pocket costs for on the back end when they receive their healthcare services.
So to sort it out again, Medicare, original Medicare, would it cover some of these things that we've discussed, or is it going to cover everything with maybe an unlimited cap or no cap? Really?
Right. So Medicare Advantage would have a cap. Original Medicare does not, right?
So it could cost you 5, 10, 15. It could cost you a lot of different
Exactly. So the Medicare Advantage maximum out-of-pockets, they really range, especially locally, somewhere between $6,000 and $9,000 in total out-of-pocket costs. Well, a Medicare supplement, if someone is really looking at the difference between the two, if they're encroaching between $3,000 and $4,000 in medical costs due to cancer, maybe rheumatoid arthritis, with injectable medications at a physician's office, we really want to look at that and analyze and figure out, well, what is that dollar amount that they're coming out? Would they save money by paying for a Medicare supplement plan, but not having a cost when they go and receive those services?
What if someone's health changes? I'll just continue to use myself as an example. I started into the program at 65, and I'm doing pretty good. Yeah. But at 70, the wheels come off the bus. Do you have to start again and reconnoiter the plan again? Not
at all, no. So this is an ongoing relationship. This is something that when our representatives at Essential Solutions sit down with somebody, that individual at that point going forward, we hope that we're going to keep a relationship and work on these things on an annual or as they come up, because we may be able to change coverage to something that's going to be less costly for that individual.
A lot of people now have healthcare coverage through traditional insurers, yes, major names that are out there. Do you still need to work with an insurer when you're going on the government plan for Medicare or Medicare Advantage?
So yes, Medicare Advantage is through a contracted carrier. So locally we have quite a few of them that have a contract with CMS, the Centers for Medicare and Medicaid Services, to offer Medicare plans. So yes, you are going through an insurer on the Medicare Advantage side.
Is that important to do, or can you go it without the insurance?
That's a great question. That is probably the most important question there, is going without full coverage. You want to make sure that you're careful, because there's potential for Part D, as in drug penalties, if we don't go without full coverage.
Let's talk about the parts of Medicare. Explain them in the different.
So we mentioned some of them a little earlier. Medicare Part A is hospitalization.
A is hospitalization.
B is outpatient medical.
Okay.
C is actually considered Medicare Advantage. And I like to draw it out as if we were going right down, we would go A, hospital, B, medical, D, drug, and I draw a big C around the A, B, and D because Medicare Advantage will cover all A, B, and D. So hospital, medical, and drug coverage all into one plan.
So why wouldn't everybody just go on Medicare Advantage? It seems like that would be the best of all the
That's
options.
where the majority of Medicare beneficiaries sit, is on a Medicare Advantage plan. But health needs change. So as health needs change, if they become significant enough, like a cancer diagnosis, there's a lot of diagnostics, there is a lot of imaging, there's a lot of treatment done on an outpatient basis. And as those costs increase, we want to take a look at potentially moving over to a Medicare supplement. Medicare supplement plan now uses original Medicare as primary coverage, and then the supplement does exactly what it is meant to do. It supplements original Medicare, keeping back-end costs low for that imaging and testing, excuse me.
Is everybody qualified for Medicare or Medicare Advantage?
So every U.S. citizen that has worked for 40 quarters in their lifetime has paid into Medicare Part A. So yes, those individuals would be eligible, or individuals who have been on Social Security disability for 24 months are also qualified to have Medicare A.
So you don't have to be 65 if you have another condition that you're disabled.
Yeah.
Is there an age bracket that fits in?
That could be anyone. There are even pediatricians on within networks for carriers, because there are individuals who are younger on Medicare due to disability.
Right.
My father, for instance, is under 65, and he's on Medicare due to a disability.
We talk about open enrollment. You see a lot of, particularly on WBBZ and some other TV stations and radio, you hear a lot about between October and December, now's the time to sign up and come on and talk with us.
Yes.
Is it just during that period of time that somebody needs to come to you, or is it any time during the year?
No, anytime. So between October 15th and December 7th is really when everyone seems to think that that's the only time to make a change, and it is not. We have open enrollment period, which is January 1st through March 31st, and even all throughout the year, we have special elections that can be used to change coverage for the first of the following month.
So that open enrollment period is what it is, but then there are other times as well.
Absolutely.
Yeah, the key, though, is to connect with you at Essential Solutions USA. We're going to have contact information for Ken Sciarrino, and we're going to continue our discussion about some of the maybe disadvantages of what coverage might or might not cover right after this break. We'll be right back. Buffalo Healthy Living Magazine is a free, full-color magazine distributed throughout Western New York. Now, more than ever, as we all want our families and friends to be safe and well, Buffalo Healthy Living Magazine is devoted to health, fitness, and nutrition for people of all ages. It's a great read and also has great recipes. Pick up Buffalo Healthy Living Magazine all over our hometown, or go online anytime at buffalohealthyliving.com. Welcome back to your Hometown Health Connection. John DeSciullo here, and we're talking with Ken Sciarrino, Regional Vice President of Essential Solutions in the Northeast region, to get us through the Medicare Maze. You liked that, didn't you, Ken? The Medicare
I love
Maze.
that.
Yeah.
I love that name. Yeah.
Why does it sometimes seem like the government throws complications at us? It shouldn't be that
It
complicated.
shouldn't be that complicated. It's job security, I guess, for me, in a way,
That's
right?
true.
But it's complicated, and we try to take that complication out.
Well, and I guess in all seriousness, it has to be complicated because everybody's different. It can't be sort of a one-stop shop. You have to, like we talked about in the previous segment, account for the differences in someone's health condition.
Yes.
And in some cases, someone's financial condition as well. So let's get into that. We talked about Part D and prescription plans. What are some of the advantages of that?
Of adding prescription drug coverage
Yeah.
in. Well, obviously, adding prescription drug coverage in, if it's included in a Medicare Advantage or a standalone drug plan, could really help someone avoid a Part D penalty, right? If someone is on Medicare and they go 63 days or more, believe it or not, this happened to my mother-in-law, went more than 63 days without prescription drug coverage and actually had a penalty once she added drug coverage. So it's very important to add your drug coverage on as soon as you go on to Medicare. or have at least like coverage to a Medicare prescription drug plan.
Because sometimes the drugs can be as expensive as the care itself, and particularly over a period of time when it's protracted, if someone is prescribed something that's costly to begin with and needs it every single day.
Yes, yeah. So it can help dramatically reduce the out-of-pocket. So speaking of advantages, is dramatically reducing the out-of-pocket costs for medications.
So an out-of-pocket cap, $2,000. What explain that?
So these plans, they have formularies. Every insurance carrier plan has a formulary. It's our job to check those medications that the individual is taking and see what tier level do those medications fall on. Tier 1, 2, 3, 4, and 5. Tier determines cost. That we then figure out what out-of-pocket cost is on those medications, and do they have a deductible amount for their medications. It will come out to a copay or a co-insurance after deductible, if there is a deductible. And once they reach a $2,000 out-of-pocket cap, they have no other costs for the remainder of the year. But that can be quite costly for an individual, so sometimes we have to put them into a payment program, help spread that cost out over the course of the year.
Right, $2,000 for some is easy to pay. Sometimes it isn't for others, so you can spread that out. That's good to know, and you'll help them navigate through that.
Absolutely, and we'll also help navigate. That's one thing that all of our agents at Essential Solutions do as well, is we analyze income to see if they qualify for subsidies. So looking at something like Extra Help or New York State Epic, these can help reduce even further some of those medication costs.
Right. Let's talk about insulin for a minute. It seems to be a lot in the news lately, and the cost of insulin. Explain why it's so important.
So insulin, it was costly, and now it is capped at $35 every time an individual on Medicare needs to pick up insulin. There's a $35 cap. Now that does not apply for someone who has Extra Help, maybe lower income and has Extra Help low income subsidy, helping with the cost of their meds, but someone who does not qualify for that really allows them to get their insulin.
Let's talk about manufacturer discount program to reduce cost.
Yeah, so there are some manufacturer discount programs that are available. If there's a medication that's non-formulary that someone wants to maybe go another avenue to help with the cost of a medication, that is something that we also will help navigate for our members as well.
Let's talk about some of the potential disadvantages that we may see coming down the pike. What do you see based on your expertise? I
do see what we found recently. I don't get involved in politics, but we do know that there's increased reimbursement to insurance carriers. So there is going to be some investment still into Medicare Advantage and drug plans. But there's always potential for higher premiums, so higher cost of plans. Sometimes higher copays. We don't necessarily know what we're going to get into for the next year until we as agents and brokers, we start to see what those plans are going to look like as we get closer to the annual enrollment period.
Right. So you can't predict it, but it could potentially happen that higher premiums could exist.
Exactly.
Would that mean that $2,000 cap might go up a little bit potentially, or?
As far as I know, no.
Okay.
I believe that would stay put, but again, I'm not CMS, the Centers for Medicare and Medicaid Services.
And explain what CMS is and how that works.
That is the governing body of the Centers for Medicare and Medicaid Services, really our governing body as well, which provides us with all of our compliance guidelines on how we work with. We're not the government. We are licensed health insurance advisors in New York State with contracts with the carriers to provide accurate information. But CMS is our federal governing body.
I have my notes here, limited drug options. Does that mean the difference between, say, a generic brand and a brand name? Is that where that?
Well, so there are generic options for many medications. There are branded options. Sometimes there's a brand that still has a patent and maybe a higher tier medication. But most often there is a generic alternative that can keep costs low on a tier 1 or 2 for a client.
Right. It's very interesting. Some friends, as you get older, as I am, you hear about their different medical needs and the cost of the drugs and the difference in cost and its availability. It's really quite complex in some situations.
Absolutely, it is.
Let's talk a little bit about someone who needs extended care maybe in a nursing home or an assisted living. I had to put my mom in a nursing home years ago, and it was quite a journey. You have to, and others on our crew have done the same thing, and you have to kind of disconnect yourself emotionally from the business of it. And it's very difficult for somebody going through that. What is Medicare, or does it cover that at all?
Right.
Or what is the difference in coverage if you have to seek that kind of help?
Right, so that is a completely different type of coverage. So anyone watching that is still within their 50s or early 60s, hopefully you are looking at long-term care policies, right? Medicare is not a long-term care policy. It does help with skilled nursing facilities, so it will help with a benefit period of a skilled nursing, for a skilled nursing, but it is not nursing home or long-term care. That's a different type of coverage.
Different type of coverage. But if somebody needs that care, does the government cover it?
If they're moving into a skilled nursing facility, yes, they would have no cost for the first 20 days, and then the benefit periods kind of are determined what their out-of-pocket costs would be, but it's transitional.
Right.
It's limited.
So somebody should see you about a lot of things, and they shouldn't put it off. And if somebody were to come to see you, Ken, or one of your associates, is there a fee for your consultation?
No, there's no fee to work with us whatsoever. We're licensed and, as I mentioned, certified with each carrier. If a consultation happens to go the route of finding a gap in coverage and moving to a different carrier, we're ultimately paid by the carriers when an enrollment happens.
So if you're watching, friends in Western New York, you'll have a chance to find out where the local address is. If you're watching online and you're watching from another part of the country where Essential Solutions USA offers services, we'll have a website as well. And even though Ken is with us today and you're the face of Essential Solutions USA right now, you have a lot of different people, not only in Western New York, where we're originating this from, but across the country.
But nationally as well. So as you had mentioned, our website, essentialsolutionsusa.com, you can actually find an agent. You can plug in your zip code and find an agent near you. So here locally, we had talked a little bit about different areas of Western New York. We had mentioned Batavia and Angola. Wherever you may be in the North Towns, South Towns, feel free to plug in your zip code. You can contact me directly, or you could work with one of almost 80 individuals in Western New York.
So Ken, there's no fee to come to see you or one of your associates. But when should somebody come to see you and one of your associates? What is the right age to start this process? Is it at 63? Is it, you don't want to wait till you're 65, you might be late.
I mean, I like 64 and a half, right? As you're turning 65, I just spoke with a potential client earlier today, and she said that she and her husband, they have similar birth dates. They were going to call me in a few months because they're 6 months away from their 65th birthday. Now, if you're on Medicare already and over the age of 65, you could call us anytime. We could do a consultation. Most of us keep an open schedule so that we can add new clients daily.
Should you bring medical records with you? What do you need to bring to the consultation?
I tell everyone, bring your original, if you're new to Medicare, you're not going to have your original Medicare card yet. But a list of doctors, a list of medications is usually all you need.
Do you need to bring tax information, financial information?
Most folks do know how much they're receiving in income, whether it be Social Security or if they still have wages or other income. But no, that's not really necessary. We can have the income conversation and figure out if there are subsidies just based on what the individual knows for the most part.
Right, because that's another challenge. Some people have the Social Security challenge in addition to Medicare, so it's a lot to think about. But once you sort it out and once you meet a friendly face like you and your associates, it makes it a whole lot easier.
It should.
What got you motivated in this for such a young guy to be doing such complicated work for seniors, basically?
Right. I mean, being from Buffalo and a former accountant, this was a natural fit. I seemed to have some individuals that I knew that were working in this industry, and then I started helping family, in-laws, parents, grandparents, and I found it became a passion. And now, doing it on a daily basis, no 2 days are alike, no two situations are alike. And I find that that's what a lot of our agents, our brokers say as well, is that no two situations are similar. So every day is interesting, and each client has a new interesting story to tell.
Yeah, I would think you finally, in our final question, you're able to really connect with those people and establish a relationship. How do you keep track of everybody?
Oh, we have systems that do that for us. So as we talked about, health situations change, right? We have to be able to keep good records. So we have systems that keep records, and we can pull that information up and change health, situations, medications, doctors, etc., and really in real time figure out whether it's time for a plan change or not.
We talk about going to see you, and we'll have a local address, and we talk about the web. Is there a way to do a consultation online or virtual?
Yes.
Is that suggested, or does it all have to be in person?
We can do everything over the phone. We can do everything through Google Meet or Microsoft Teams. We can do everything in person at an office as well.
So the technology, if you're not daunted by it like I am, and you want to do that on a Zoom call,
Yeah.
you could figure that out.
Absolutely.
I think COVID taught us that lesson, that we can use technology
That's where it
to our
started.
advantage.
Absolutely.
What would you suggest? Is it better to come in person or do something online?
I love meeting everybody face to face. If they don't feel comfortable with that, that's a-okay.
Yeah.
I have a number of clients that I've never met. We've just worked over the phone. We do call recordings, so for compliance purposes. But yeah, either way is fine with me.
And we should probably mention that this is all controlled so that the information that you're getting is not going to be divulged. You
Not
have
at all.
systems in place to make sure that their
Absolutely.
medical information, the financial information is held in proprietary.
Everything is encrypted. Any paper documentation is held in locked file cabinets. Legally, it has to be 10 years plus contract year. So we're holding individuals' important PHI, personal health information, PII, information locked away and safe.
Great. Well, Ken Sciarrino, it was great to have you here.
Thank you so much.
We learned a lot. I learned a lot particularly. And we're going to have more information on where you can connect with Ken and Essential Solutions USA. Ken had a lot of great information, and if you would like to connect with Ken or another one of his agents, it could be a meeting that will change your life when it comes to your health care, particularly as you get older. Now here's the number that you can connect at. Area code 716-870-6663. Get out your pen and paper, write that down, keep it on the screen, 716-870-6663. Plus you can go to the website that we talked about in the program, essentialsolutionsusa.com. And Ken has an email, ken@essentialsolutionsusa.com. That's the email. Or you can go to their local office at 34 Patrick Lane in Depew. Now, if you're like me and you need help sorting all this out, don't wait. Connect with Ken. Thanks for watching this edition of your Hometown Health Connection. Be safe and be well. A production fee for the preceding presentation of Your Hometown Health Connection was made by Buffalo Healthy Living Magazine and its sponsors.